Hello, my name's Margie Urban, and I'm coming to you on behalf of the New York State Clinical Education Initiative to talk about some strategies to use for offering telehealth services to provide STI care during the COVID pandemic. A few caveats before we begin. This is really just a few-minute presentation to give an introduction. These are possible strategies to adapt to this ever-changing situation. No formal recommendations, really just sharing our experience in our sexual health clinic. We have found it's important to review the data very often. We're doing it weekly to try and improve and adjust our protocols. The CDC has issued some very helpful guidance in early April that I'll show you. And you can find some other helpful resources that have been collated by the NCSD, National Coalition of STD Directors, found on their website, shown here. So really there's two types of visits. The in-person traditional visit or a telehealth visit, which in our hands is really an audio-only visit. We're not using any video connections. In our setting, a patient may cold call, equivalent to a walk-in visit, and be connected to a clinical provider, or we could have a set-up appointment with a patient and they'll be contacted by the clinic provider. The guiding principles really are to minimize the need for the patient to leave their home. We're trying to promote social distancing and avoid interaction with a potentially high-risk healthcare facility. We do, however, want to provide safe and effective treatment for STIs using syndromic management, and we want to minimize the risk of any adverse drug reactions or certainly not contribute to the development of antibiotic resistance. We do take care to document verbal consent to have a telehealth visit. And if it turns out the patient is calling really just for screening and they have no symptoms, we either tell them to defer and call back in a few weeks, and maybe we'll be offering screening on site, or if we have access, we offer home testing for STIs. If it turns out the patient's calling for HIV post-exposure prophylaxis or emergency contraception, we link them immediately to a clinic, our clinic, or another clinic, or a pharmacy that has med on hand for that purpose. Then we go into, for the others, sexual history, much as you would in an in-person visit. So in getting all the important information, we want to be sure to know about recent antibiotic use, drug allergies, past medical history, and any other medications that might interfere with something we prescribe, and a description of whatever symptoms they may be having. Because we won't have any laboratory testing or an exam, we want to be particularly alert for risks for complicated infections like fever, abdominal pain, pain with sex, scrotal pain, or the possibility of pregnancy that might impact our treatment. Then the visits break down into two possibilities: those without symptoms but not just seeking screening but calling because they think they were exposed, either as a self-reported contact or a confirmed contact through the health department. If they were a contact to chlamydia, NGU, or trichomonas, we do an e-prescription in New York State for the appropriate treatment, either treatment for chlamydia or treatment for trichomonas. If they're a contact to gonorrhea, cervicitis, PID, proctitis, all syndromes that could be caused by gonorrhea or chlamydia, we do an e-prescription for both of those things. So now we're giving oral medications for contacts to these conditions. But with the use of oral medications for gonorrhea, you are a little bit concerned about promoting resistance. For syphilis, in our setting, we are still bringing those people who are contact to syphilis in so that we can get the appropriate testing and provide the best treatment with benzathine penicillin if indicated. But we do know other locations that have higher rates of COVID or maybe less access to in-person visits in this time. They're using doxycycline for non-pregnant patients. For those who you're on the phone with and they have symptoms of a typical STI syndrome, such as urethritis, cervicitis, proctitis, vaginitis, or even genital ulcer disease, we aim to treat empirically, again with oral meds through e-prescriptions. If they have abdominal pain, fever, some other concerning event where you really feel like you need an exam, we bring that patient in. In our setting, we have chosen to also bring in those with symptoms of proctitis or symptoms of syphilis. Others have just used e-prescriptions for those. We have run into the situation with telehealth where we do the e-prescription, but then the patient says, but I don't have the capacity to get those medications, either for financial reasons, lack of insurance, or maybe rural settings and lack of access to a pharmacy. And here you might want to consider contacting your local health department, who often offer point-of-care medications or have some other medication assistance program, particularly for reportable STIs. The CDC has issued this very helpful Dear Colleague letter on April 6th. It is quite flexible and pragmatic, and it describes syndromic management. In the left-hand column is the description of the syndrome. Here is a description of the preferred treatment when an in-person visit based on CDC treatment guidelines. Here are some alternative treatments to use when only oral meds can be given because of telehealth. And the most important to note is this new recommendation for the use of Cefixime, 800 milligrams as a single dose for the treatment of gonorrhea or syndromes caused by gonorrhea, plus azithromycin or doxycycline, as might be used when you use injectable ceftriaxone. If for some reason you couldn't get Cefixime 800 milligrams, it is possible to use cefpodoxime 400 milligrams given as 2 doses 12 hours apart, so 2 doses in one 24-hour period, also along with azithromycin or doxycycline. These are both new recommendations not included in the 2015 CDC treatment guidelines. The recommended follow-up are if symptoms do not improve within a week, to be sure to come in to be seen for examination or possibly testing or alternate treatments, and to recommend comprehensive STI HIV testing once that's available in your area. Here's some additional internet resources and some pictures of what those websites lead you to, which are all various guidelines and guidance for patients to describe ways to be safe with sexual health during COVID-19. For additional resources from CEI, you can go to our website at ceitraining.org. There's a calendar of live training events or archived trainings with much more detailed information about syndromic management with CE accreditation, and access to the CEI line for clinicians who have clinical questions. Thank you.